recording.
We're good?
Yes.
Hi, this is John Palmer, Olympus Urology Rep, and today I'm going to go over our vaporization TURP sets with our orange Gyrus ACMI PK generator. So, generator, when we're using it for bipolar TURPs and bipolar bladder tumor resection. The generator has a power switch in the back left, so when you go to turn it on, you're just going to flip this over, and it's going to power up in the front. And obviously we have our foot pedal, which stays plugged in, and it's plugged in the back there, the back left. Takes 10 to 15 seconds, go through a self-check, and the generator is ready to use at that point. On the tray, so we have 3 of these Olympus vaporization TURP trays. This is bipolar. We'll use a generator. You're going to hang saline as your fluid. You don't have to ground the patient because it is a bipolar plasma energy. When we open the tray, we're going to have our scopes here in the top. We've got a 30 and a 70 degree scope. The 30 degree scope we're going to use for the resection. When you pick these up out of the tray, they should have the scope protectors on them. Pick it up by the eyepiece. Just in case this isn't clicked in, we don't want to pick it up here and the scope slide out and fall on the floor. So pick it up by the eyepiece, and then you'll unclick it from the scope protector. Obviously everything's going to stay sterile. And your scope's in the top tray. We have our light cord with this. You can use our light cord or your other OR light cords with your camera heads. We're going to pick up the outer resectoscope sheath. We're going to pick up the inner resectoscope sheath, and then we're going to pick up the obturator. This is the resectoscope sheath portion. Everything slides in. The inner is going to slide in and click. The outer, oops, as I'm almost dropped it. It's going to slide in there, and there's a little arrow there. It's going to line up with the black button. Everything clicks in. So this is what the physician will go in to start the procedure. We'll lubricate this up. Go in. This will be in the patient. This stays in. The obturator comes out. I'm going to just set this down just for a moment. We're going to have our working element, which is, where'd our working element go? Oh, there it is. So this is our working element. You're going to load your lens. It will load in and click. And we want to check that this should slide in just nice and smooth. You shouldn't have to force it. If you feel a lot of resistance or you're having to really put a lot of pressure, after the case, tag it and for repair, and then we'll look at getting it all straightened out. So this will click in. The electrodes are going to be sterile. We've opened one already from this morning's in-service. So we're going to use loops, and then we also have what's called buttons. So grab the appropriate electrode. You're always going to use a loop, almost always use a loop. A button just depends on the procedure. So we've got our cord and then our electrode. You want to obviously maintain sterile technique. This larger end you're going to pass off to your circulator in the room. This is what's going to plug into the generator, the larger 5-prong end. So it's going to plug in on the right side. It will not work on the left side. It plugs into the right side that says PKSP. So plug that in, and set this down, and it's firm. Plug it all the way in, and then as you saw, it recognizes here what we plugged in. It's plug and play. We don't have to worry about making any adjustments on the generator. So we have our electrode that we pulled out of the packaging, and we're going to backload that right here onto the resectoscope, and that's going to load in, and then you're going to feel it click in just like that, and you can check it to make sure it's clicked in. So if you remember from earlier, this is in the patient. Physician, he's going to click that in. So we've got this clicked in. Now we need to hook up the other end of our cord. So this has stayed sterile. And again, we're hanging saline. We don't ground the patient. We don't need to put a grounding pad on. So the first active is going to go on this little pin in front of the light post. So you push that down firm, and then the return electrode is going to attach right here on the round white light post, or round white post, and attach that right there. Your light cord is going to attach right here from your light source, and the physician has their pedal, and we're ready to go. And they'll do the procedure. If they need to use a different electrode, as I mentioned, they'll generally use a loop always, and if they want to use a button on the same procedure, which is common, they will want to change that out. So to do that, they're going to remove this inner sheath. This generally just stays in the patient. And to release the electrode, we push this black button. I'll remove that also. We'll push this black button. That releases the electrode. You would get your other electrode and simply just slide it back in and hug the scope there. It clicked in. This is going to be on. And then we go back into this is in the patient. And then we clicked in and we're good to go. And that's the basic setup on the resectoscope. At the end of the case, we're going to take this apart if we can and throw the electrode away. So the outer sheath, it disassembles. The inner sheath, we push that black button, it disassembles. Push this black button to take the electrode out. You'll throw that away in your sharps or your container. This cord is also discarded, so you just pull that up, and then you're going to remove it from the generator at the end. This will all be discarded. And if you can, to remove the scope, and we can put it in the protective sheath on the way down just to prevent any damage. To release the scope, there's another little black button, because if I pull right now, this won't release. So push that little black button, that releases the scope. And then if we could, we're going to put it back in the protective scope holder. So that's our plasma resection set. We have some other instruments that we use in here with it that go along with it, but that's the resectoscope portion for TURPs and bladder tumors with the BiPolar set.
Thank you.